Water retention, lots of water retention. Sometimes that's entirely ignored. I've had women say after their first dose of progesterone, they were up all night peeing because they had so much accumulated fluid. Finally, they had progesterone acting as a diuretic to relieve them of all that extra fluid.
Any health-related information on the following show provides general information only. Content presented on any show by any host or guest should not be substituted for a doctor's advice. Always consult your physician before beginning any new diet, exercise, or treatment program.
Welcome to Accelerated Health with Sara Banta. I'm a busy wife, mom of 3, and an NANP certified supplement professional. But that's not all. I'm also the founder of the multi-award-winning Accelerated Health Products, a brand offering innovative natural supplements to optimize your health. This podcast is not just a source of information, it's a community. We're all here to learn and grow on our health journeys, regardless of where you are in that journey. And this podcast is the springboard to learning, and the free group coaching on Telegram is where we continue learning together. You can ask your questions. I post tips and tools to deepen your health and to keep you moving forward. So here's what you can expect. New episodes every Monday and Wednesday with in-depth health discussions and expert guests. Hot topic issues that are in the news every Friday to keep things interesting. And then, of course, the free group coaching on Telegram to keep you moving forward. You can find all of the information at sarabantahealth.com. Have you thought about detoxing? Well, I've created over 10 unique, easy detox cleanses to help you reset your body while feeling great. You don't have those detox flu symptoms, so just take the detox quiz, link on the site, and find out which one is right for you. And if you don't know what supplements to start with, or maybe you don't need any, just complete the health goal form on my website, and I will personally put together a protocol for you. So just taking a few steps forward with your health, you will see a change in your life, and I'm here to help you along the way. And I'm super excited. We have got Carol Petersen here. She's an accomplished compounding pharmacist with decades of experience helping patients improve their quality of life through bioidentical hormone replacement therapy, which has been controversial over the years. And she's here to explain. Carol, thank you so much for joining us. I have so many questions, and so many people do. And we are going to be talking about the hidden hero of hormones, and that is progesterone, right? So welcome. And, you know, I've got some stories to tell you about my own family. But before we do, why don't you just tell people why you've become so passionate about progesterone when everyone else is focused on the other hormones, right?
I don't know why. One person on a Facebook page said, is your solution to everything progesterone? And I said, everybody here is low on progesterone. I'd love to talk about other hormones too.
Yeah.
It's epidemic. And it was first identified as a solution for PMS way back in the 1950s. With Dr. Katarina Dawn, published some wonderful studies, published some books. And the curious thing was she wasn't even measuring low progesterone in the luteal phase, which was when all the PMSy type symptoms occurred. But progesterone nonetheless amazingly took care of all these symptoms. And she used doses that were quite high. She started with injectable, and then she changed to using vaginal suppositories, or you could use it rectally, 400 milligrams, 600 milligrams. So when I worked at Women's International Pharmacy, we had taken this concept, and 2 researchers, Joel Hargrove and Wayne Maxson, had looked at providing progesterone in oil. And even my old Goodman and Gilman from pharmacy school says progesterone is not useful orally because it's not absorbed. But what happened since was the particle size got smaller and smaller, improving absorption. And then having the steroidal hormones with oil, if you're having it orally, helps it get absorbed like a fat. So a different absorption pattern. The idea was to offer another option using Katarina Dalton's type therapies, but offer an oral progesterone. So our starting dose was 100 milligrams 4 times a day in oral capsules and increase from there. And we'd have women taking more capsules. They would eventually we added other dosage forms. We had lozenges, creams, gels, rectal solutions, vaginal inserts, drops, whatever we could do, even injectable, to get progesterone up. And this relieved the symptoms. Hands down, it works. I know it works. I've seen it hundreds, if not thousands of times. And then when we would have situations where somebody was doing pretty good on the dose they were at, they could feel some anxiety and stuff coming back or a headache coming back. Their doctors gave them doses extra to add during those days when their symptoms were getting out of control. So we called it breakthrough. Now, now there's other terms and whatnot, but it has to be generous progesterone to do this. And this is particularly true of the younger women who should have plenty of progesterone, both in the follicular phase from their adrenals and huge amounts of progesterone in the luteal phase from the ovaries. And unfortunately, because of bad food, bad air, bad lifestyles, we are depleting our progesterone all over the place, and we suffer. The trouble is, these young women don't have a clue that it's just hormone issues that are happening for them.
So I'm so glad you talked about the lifestyle and the modern day environment we're in. We're not dealing with our mothers or our grandmother's situation, right? We've got glyphosate, we've got the GMOs and the toxins, the heavy metals. I always talk about all of this stuff, and I talk about the liver being able to process all of this stuff. It's being backed up, and I want to get into the liver's role in the hormones in a minute. But here we have, I know people think of, oh, well, hormone therapy, we do that for the old women. But these young women, why are we so low in progesterone in these younger years? And this is what I was going to bring up is, even in my own family, we eat organic, we eat wild meat, we stay away from the toxins as much as possible, but it's in our air and our water and our food supply, regardless of what we do. And my youngest, she had menstrual cycles with a pain level of 4 normal. This was like 4 or 5 years ago. Then we've got what's been going on, and we have to be very careful with how we talk about that. But over the last 4 years, her menstrual pain has gone to a 12, where she's throwing up, she's nauseous. Mom, I can't do this anymore. Something's really wrong with me. What's going on? And what we have uncovered is that her progesterone was really low, stress levels high. Now, what came first? The progesterone's low and now I feel awful, so my stress is high? Or did the stress come from school and sports and friends and all that stuff, and then that caused the progesterone to go lower? So there's this feedback loop. And then you've got these hormonal cycles that are so painful, more endometriosis, more PCOS, more infertility, more just not even be able to get pregnant and then losing the pregnancy. So why are we seeing so much more of this go on in these younger years? But that I want to get to. First, let's talk about what's progesterone's role in the body.
Okay, John Lee wrote a pretty good book. I think he did us some disservice on some of the things he said, but his book, Progesterone, The Multiple Roles of a Remarkable Hormone, does talk about this. And it does so many things you can't even imagine. One of the things, as we started talking about, it's a precursor for cortisol, which is a stress hormone. And you have to have that go up high for you to manage the stress. So where's that coming from? It's coming from your adrenals. It's also coming from your adrenal progesterone. Sometimes we have a situation where you've been so exhausted adrenally, cortisol is deficit, cortisone is deficit, all the other corticosteroids, all the anti-inflammatory things that keep things quiet are all depleted. So when you start progesterone and you use just a little bit, that's not enough for that cascade. You just make everything worse if you don't give enough. Then there's the mast cells. The mast cells have a complete hormone factory in there. And if estrogen dominates over progesterone, histamine will be released. So we have all these strange stomach pains and what's the other, itches and rashes and things, histamine reactions, runny nose even from from your hormones. And progesterone is an antihistamine in that way. It will balance the estrogen in the mast cells so you won't have the histamine released. And then the Schwann cells in the nervous system tissue. These are cells that are used to repair the myelin sheath. Pregnenolone, progesterone is made there. It's used right there. We never can measure this on any test. But you can use progesterone exogenously, put more in your body, and it will work on your nerve cells and help nerve pain and neuropathy. I put some progesterone on a man who said he couldn't feel his feet. One dose, and he could feel his feet. So that progesterone was just taken right up by those cells, desperately needed it. The brain. The brain makes its own hormone cascade. It makes its own cholesterol. It makes all the hormones. If it's not able to do it very well, I'd like to just insert in here. I'm seeing some people with extremely low cholesterol. Mm. I've seen a cholesterol level as low as 86, 126, 136. Incredible. You can't make hormones if your cholesterol is that deficit. And it's something you should be checking when you're talking about doing a workup on what's going on with somebody. Is the cholesterol level adequate for what your body needs? And it's an important hormone in its own right. It's very anti-inflammatory. So the nice thing about this is that low cholesterol, one of the treatments is that you help top off the hormones that you're not making to have a better quality of life. So that was a surprise to me.
Yeah, and you mentioned men, which is so interesting. No one thinks about progesterone with men, right? Just like they don't think of testosterone with women. So how is progesterone related to the menstrual cycle regulation and pregnancy support?
Okay, so progesterone's there all the time, pretty regular amount from the adrenals. Then when you release an egg, a corpus luteum is formed, and that starts releasing progesterone, and that's the luteal phase progesterone. Progesterone has two activities during the luteal phase. In the first half of the luteal phase, it actually stimulates estrogen to make an even more cushy endometrium than was formed in the first part of the cycle to accept a fertilized egg. Then about mid-cycle is actually when progesterone's at its highest. When there's no egg, now it turns into a secretory hormone. It makes that layer that you just built up able to be shed. Sometimes if you don't make enough progesterone, they call it shortened luteal phase, or sometimes just inadequate progesterone. You could have a missed cycle. You could have scanty bleeding, but it's still the endometrium is building up silently where you don't know it till you have odd bleeding and somebody checks on you to see what's happening. So when you get pregnant, you've gotten to this high dose of the highest of the luteal phase layer, and it's maybe 20 to 30 nanograms per mil. And this is where you're going to stay until the first trimester, when the placenta has been developed enough to make even more progesterone. Textbooks used to say like 50 to 200 nanograms per mil for pregnancy, all terms. Now I see some lab tests going all the way up to 550 for progesterone, which is one of the questions I'm asked a lot. Can I give too much progesterone? In my mind, you have to get beyond that third trimester huge level of progesterone before you can talk about toxicity of something. It's completely normal for the human body to experience that much progesterone. Katerina Dalton did an interesting thing with her PMS ladies. She continued progesterone every day after they got pregnant, did not drop them down at all. They used it for the entire pregnancy. And then 10 years later, she went and checked out the kids. And she found them to be better socialized and brighter than their peers, except they were not excelling. They were just the same as in sports. So I don't know what that means. So,
That's interesting. Maybe it's balancing out the testosterone, because you need a ton of testosterone to go and do those sports.
okay, I want to say a couple more things about pregnancy. So it's become apparent to me that what's probably happening when you have nausea is that you don't have enough progesterone in your pregnancy. More progesterone should help. You get immediately high rise in estrogens. Estriol goes way up right away. So now you have maybe not enough balance of progesterone and you're nauseous and vomiting. When you get through the first trimester, sometimes it leaves because now you have a lot more to work with. But should we be suffering during that first trimester? And it occurred to me, we used to use B6 to help with nausea. Well, what's B6? It's an important coenzyme for progesterone. It helps progesterone work. So it makes sense that it could be helping with that nausea while that's going on. So I think there's no reason to be nauseous while you're pregnant. And then furthermore, Dr. Ray Peat wrote about this. It was if you develop gestational diabetes. He wrote maybe just a episode, one of his newsletters. He said when that happens, you don't have enough progesterone. Your body has a backup system to keep the blood glucose up, and that's the development of the diabetes. So the baby's brain still has enough glucose.
Right.
So it's a fallback mechanism. I think that's probably true too, but I haven't seen any place where they actually just went ahead and gave more progesterone and reversed it. So I don't know.
Interesting. So in general, what are the signs that people should look for for having too little progesterone?
Well, I have about 125 things on my website. I have a progesterone deficiency blog. And I think it's important for people to look at it because a lot of them are not necessarily associated with low progesterone. How about rage?
Right.
Low progesterone. How about weeping? Low progesterone. Water retention, lots of water retention. Sometimes that's entirely ignored. I've had women say after their first dose of progesterone, they were up all night peeing because they had so much accumulated fluid. Finally, they had progesterone acting as a diuretic to relieve them of all that extra fluid.
Wow, you probably just got a whole bunch of women going, wait a second, I need some, because we're all retaining water. So you've got the mood swings from rage to weeping, which seem like the opposite, right? The PMS symptoms getting so much worse, irregular periods, and the miscarriages, the infertility. What about high progesterone symptoms? Are there many people running around with too much progesterone?
I haven't met one yet. There is one situation where you wouldn't want to give progesterone, and it's adrenal hyperplasia. It's a genetic thing, and you get too high of 17-hydroxyprogesterone, and it's unable to convert to cortisol. So that's how you follow it. You don't want that to get too high, and you have to use cortisol directly to manage it.
Okay.
Only thing I know where giving progesterone could be a problem.
And is there a risk of overdosing? So you've got someone with low progesterone, and I know you talk about everybody needs different levels, and some people need a much higher level than they think of. But is there a risk in giving someone too much?
The risk, I think, is too little. Now, this hasn't happened to me in a long time, but I had a woman actually. She got up to about 1,600 milligrams, was hugely anxious and still even more anxious. She needed to go up further, but she got afraid. That's understandable.
Yeah.
And went to the hospital. All they did was give her IV fluids and said, go see a cardiologist. Well, that's not going to help much. She's got way too much adrenaline going on. Progesterone theoretically is the thing, and maybe hydrocortisone, and maybe she needs cholesterol and pregnenolone too in that whole pathway to handle that. I can't help when you cut it too short. You haven't flipped it yet.
Right.
And it's really scary for women to use more when they've used a little and had a bad reaction. They say progesterone is not for me, and it isn't when you take a little progesterone. Please don't take a 10 milligram, 30 milligram, and expect for it to do you any good. It probably is going to do you more damage. So I like many times starting at 200 milligrams and up, and just jumping over that low progesterone problem.
So before we get into, we're talking about hormone replacement therapy, but I always like to look at what is the cause. What is causing low progesterone? What can we do about it naturally through diet, through minerals, through supplements? Is there anything that you've seen that you would recommend people try before diving into HRT?
But you can do all kinds of things. Certainly, your minerals need to be there. Magnesium is really important. You can use things like chasteberry, which increases your progesterone. You can use adrenal adaptogens. You can use animal organs, adrenal glandulars, and sex hormone glandulars. You can use all that. But they don't work as well as the actual hormone. Well, hands down, you can be using these other methods, and it takes you months and months and months to get some relief, where you could have it in hours if you use the hormone actually.
So would you recommend someone starting with the actual hormone, using the other supplements and dietary support as well, and then possibly being able to get off the hormone if they build up their foundation?
Why would you want to get off the hormone? And I'm saying that from an anti-aging perspective. It's a big pillar of anti-aging medicine to bring your hormones up to a younger level or replenish your hormones. So you're going to have to take progesterone from my dying hands. I'll never do that.
Well, that makes sense. That makes sense. So we talked about stress, and whether you're an 18-year-old girl in high school or you're someone in menopause, we are all under a much higher level of stress than ever before.
Huge stress, and now we find the COVID stuff, the injections, the actual people getting sick from COVID, and they have long COVID. Guess what's depleted? Progesterone. I actually found a paper. It said, oh, progesterone's been so depleted, maybe we should use this to treat. Yes, you should. Or cortisol, so depleted, maybe we should use this to treat. Yes, you should. So we have this, I call it like a miasm of fear going on. Right now, worldwide, we don't know what's going to come next. It's been so weird. So this doesn't contribute to healthy people and making healthy babies. There've been a huge rise in missed ovulations, shortened luteal phase. Jerry Lynn Pryor did a study with 100 women in 2020, and she had they were 18 to 35, healthy young women, and she tracked the menstrual cycle for them, and she found 68% of them had missed ovulations and shortened luteal phase.
Wow.
She did a similar study earlier with 300 women. I forget how many years earlier. I'm thinking about 5. It was only 10%. Look at the change in the here and now. It's just staggering.
It is. So what is that? What is the interplay between cortisol and progesterone?
Progesterone is one metabolic step away from cortisol. So if you need to make more cortisol, it's a good place to draw it from. And the next thing you can draw it from is pregnenolone, and then cholesterol, even if you can manage to do that. So you burn up your cortisol when you're under extreme stress or you're under chronic stress. It's very debilitating. It'll just wipe you out. Low cortisol feels like the flu. If your cortisol is really low, you can't move. You can't get out of bed. And your muscles and joints all ache. And you can get rid of that in an hour if you just put, excuse me, hydrocortisone cream on.
Right.
Excuse me.
So with our young girls who are low progesterone and having all of these symptoms, the go-to is birth control. So can you explain why we don't want to do that and what the difference is between bioidentical progesterone?
Okay, you think you had trouble before. Wait till you use birth control. Now you're knocking out your own hormones. The silliest thing I've seen is a practitioner trying to measure your hormones while you're on birth control pills. They're going to be zeroed out because these are not the hormones your body uses. And that's what progesterone is. If you measure progesterone initially and you can measure it again with additional progesterone, you'll see it in the test results. You'll actually see that happen. I won't say tests are perfect. There's a lot of problems with them. But you top off your own hormones when you stick with bioidentical hormones. That's what it means, identical to those in your body. When you throw in altered molecules, you muck up your whole endocrine system and can cause just a huge amount of problems. One thing very few people know is that when you go up on birth control pills, sex hormone binding globulin rises way up, huge, very abnormal levels. And this causes interference with your body using testosterone and estrogens. These levels can persist. They don't know how long. They've tested for a year or something. Still, after stopping the birth control pill, it's still long lasting, this interference. One of the things birth control pills are notorious for, like the opening to the vagina, the vestibule, has a lot of testosterone receptors. And when you use birth control pills, the progestins have a testosterone-like action and block that. So now you have pain because that tissue is not getting any of the testosterone it needs. Eventually, you would have trouble with your urinary tract, and bladder also has a lot of testosterone receptors. Your clitoris will be affected. Your sex drive will be affected because you have so effectively blocked out your testosterone.
So what do you recommend for birth control? I mean, all of these young people are, we don't want any more babies that we don't want, right? So what is there a solution besides, the monthly time method or the natural method?
Yeah, barrier methods, condoms, and diaphragms. I once learned a long time ago, it said diaphragms actually have a pretty good track record. The failure rate comes because they left it in the drawer, not using it. So
Well, I touched on this in the beginning, and diet is a huge problem for so many issues, not just hormones. It's, causing metabolic disease, obesity, heart disease, fatty liver disease, PCOS, endometriosis. All of these things are connected to our diet, which is 70% processed food, which is not real food. Our body doesn't know what to do with it. And then you add in the heavy metals, the microplastics, and the glyphosate. How are these toxins affecting our hormonal balance?
Well, they for sure do. Glyphosate is very estrogenic, for one thing. And you can test it. Some labs have testing. And I had my glyphosate tested and I was shocked because I don't eat much bread, don't eat much of the wheat things, and I buy organic all the time. And I had a significant glyphosate level. You can't get away from the stuff.
No.
So that's one thing. Not really understood that much about the estrogenic effect of just that one thing. But we've got bisphenols and plasticizers. Mostly these things have estrogen-like effects, making even more work for your body to balance with progesterone, which you're running low on because you're stressed and you're using all of it to make your stress hormones. So you become more and more estrogenic. Endometriosis is kind of interesting. I know there's a candida overgrowth component of that. I just heard like Mark Hyman or somebody say endometriosis and fibroids are acute vitamin D deficiency. First time I heard that. So I'd certainly check that. It's a hormone as well.
And that makes sense. And it just shows that all of these hormones are so interrelated, and it's just such a fine balance. It's not just a quick, simple fix this and everything will fall in place. Now, I know you want to throw progesterone at everything and it will kind of help everything, and I'm not saying it won't, but I'm just saying that, insulin, all of the sex hormones, the adrenal hormones, the thyroid hormones. So that's where I want to get into thyroid health and progesterone. Thyroid is the master endocrine gland. There's the HPT axis, there's the HPG axis with the gonadal system, and the HPA axis with the adrenals. They're all interrelated. So can you explain how the thyroid is related to progesterone?
Right. And I will say, when I have a client, I like to have a complete metabolic panel to see all the hormone systems, also to see the cholesterol, as I just said. You want the inflammatory markers, and it's amazing all the relationships you can see with the bigger panel. The more analytes, the better, as far as I'm concerned, to see all these things and see these relationships. So repeat says there's pregnenolone, progesterone, and coconut oil help T4, the inactive thyroid, convert to T3 in your body. Mm-hmm. So there's that process. Jerry Lynn Pryor did actually publish a study and showed that P4 actually increased, but not T3, with using progesterone. I think she was using 300 milligrams. That's her usual dosing. There's an intimate relationship. So when somebody's really deplete, I always start with progesterone, and I look for thyroid markers, of course, but then I want them to look at the thyroid just a little bit later. Let's see what progesterone can fix. Let's get everybody on some iodine. If you don't have enough iodine as a primary thing, your breasts, your uterus, your thyroid's all affected. So fundamentally, you need some, and maybe you can correct it with iodine and progesterone, whatever's going on with you. We have a big amount of thyroid antibodies. Excuse me. Conventional medicine doesn't know what to do with you. If that's the case, so often they don't even measure. And it's a significant piece of underactive thyroid. So you have to fix the gut in that case. So if you don't have the wherewithal to think about how you do that, the microbiome is just hugely important. We have we can have our own estrogen recycled by a microbiome that produces beta glucuronidase and uncouples thyroid from its conjugate and puts it right back in your body.
Yeah.
So you can produce normal amounts of estrogen, but if your gut is disordered, you're making that more and more. When your estrogen is dominant over progesterone, that suppresses your thyroid more. So just getting that into balance, back into balance, can be an opportunity to fix your thyroid problems.
I love that you mentioned iodine because all of my listeners know that I'm a huge iodine proponent with the Acceleradine iodine I carry. And it is not just needed for that T4, T3, T2, the thyroid hormones, but it helps balance out the progesterone and estrogen, cleanses the blood so the liver can do its job. It's anti-inflammatory, it's antiviral, which is amazing, especially with what's going on. But it also is just so important for the mental health and so many things. So I love that you mentioned that as well. With the liver, I always say you got to love your liver. Your liver is where T4 converts into T3. And by the way, you mentioned a full blood panel and full thyroid panel. If you don't have all the numbers, it's not telling the whole story.
Right.
I have to tell you a funny story. I just had a blood test done, and one doctor looked at my T4 and my TSH level and said, "You're hypothyroid," and then, or hyperthyroid. And then I had Dr. Amy Horniman, who you know, looked at my free T3, and she goes, "You're hypo." And I'm sitting there going, I've got two practitioners that are picking apart the different parts of the blood test, and we need to look at the full picture. And you know, it's so intricate. So for all of you out there, if you are experiencing these symptoms, make sure you're not just getting your hormonal panel done, but your full thyroid panel done, your cortisol to see where your stress hormones are and all of that, but your liver health. So the liver, you got to love your liver. So much happens in the liver, including processing these hormones, manufacturing these hormones. Can you explain the connection between liver health and the hormones? And by the way, the glyphosate, the toxins, all of these things we're talking about is overloading the liver. So that is something that is a key component to getting yourself in an optimal position.
And even those low cholesterol people I just talked about, the liver makes like 95% of the cholesterol you need and use. So if that's low, you've got to look to the liver first of all. Then there's this thing, some old endocrinologists in the 1930s called it liver insomnia. And this is if you fall asleep okay and you wake up in the middle of the night and you're wakeful and you can't go back to sleep. Well, adrenaline has come up to help your blood glucose for your brain be there. But it also says the liver has not stored enough glycogen for the night. So if you wake up in the middle of the night, short-term fix is eat something or have some progesterone. Long-term fix is look toward your liver. And that's indeed your metabolic engine. Your liver has a great deal of problems if you feed your body a birth control pill. It doesn't know how to metabolize that. So those hormones can persist in your body for a very, very long time, which is also pretty dangerous for your well-being, just that being there. So the liver is overtoxicated. I like to look at uric acid now since David Perlmutter and Richard Johnson wrote books on uric acid as kind of being involved in insulin resistance and fatty liver, which too much fructose, but it's not fructose. It's the high fructose corn syrup that we have everywhere. So if you do liver function tests, which a metabolic panel can have, you don't really know just from the few enzymes that the liver is doing okay. You just don't. There's too many things you don't measure. Right. And that's why I say low cholesterol and waking up during the night, the liver insomnia are clues to a dysfunctional liver.
Yeah, and I put my listeners through liver cleanses. I propose that they do them at least 3 to 4 times a year, especially nowadays with all the things that we're being bombarded with. I know every time I do one, I feel the water retention go away, my energy boosts up. I feel like my thyroid conversion hormones are working more efficiently. My brain feels good. The liver is so important. It's the cornerstone of all of these things. And so with talking about the liver and some of the modern day diet that we are, forced upon us, what are the dietary recommendations, the foods that will help boost your progesterone and help support that?
Well, the foods that help you make cholesterol, which now you're going to have to look to animal protein, animal fat, and we actually are not getting enough protein. And the older the woman you are, you tend to use less and less protein. Now your digestive tract doesn't handle it so well, so you're reaching for more and more carbs. It's absolutely essential you have that protein. Um, so if you're in a really really low cholesterol situation, I want you to do a carnivore diet as much as you can, because you really, really need to build yourself up. You're not going to be able to do that without it.
Yeah.
Katerina Dalton, with her PMS patients, she recommended eating 5 times a day complex carbohydrates. And I did have one client who did that. She was on more carbohydrates than I would have liked, but eating more frequently was a big step up for her. Interesting enough, again, because the insulin glucose is not ramping up and ramping down. So I asked her eventually to eat more meat. She could eat less often than she was 5 times a day, and she continued to do that. So that was fine for her. I have another very brittle client, and her too. I always ask for people's uh, food intake for 3 to 5 days, and they go, "Oh, I buy organic. I eat very, very healthy." And I say, "Oh, you can't be eating these nuts and seeds and beans and expect your thyroid to flourish. Neither should you be eating raw cruciferous um, and no soy, but fermented." And it's shocking. They're making nut seed milks and cashew milks. And this is not good for your body's metabolism. You are like ramping it down. Um, so those are some of my recommendations. Usually, I'm just moving people over to more protein intake. Forget forget the pea protein. Forget the nuts and
Oh,
seeds energy bars.
you are speaking my language. I am a huge proponent of wild animal protein because it's unadulterated. It's got more nutrient density to it than any other food on the planet. The pea proteins and the vegan proteins, they're not complete proteins. They could be full of mold and estrogenic and things that are just disrupting your body, and they're not being used, right?
Yeah.
We want to build our muscles, build our hair, build our organs, and support our thyroid. And a lot of the cruciferous vegetables, the oxalates, those could be,
Kale, stay away from kale. You
yep,
do not
killer
want to.
kale.
You don't want a kale salad.
No, you don't want a kale salad. So I
We're,
love,
we're told it's so healthy for you, but I've seen it over and over again. The people are coming to me are not flourishing.
yeah,
I go,
I agree.
well, how's that working for you? Not very well, or you wouldn't be calling me. So,
Right. Well, Carol, thank you so much. We're going to have you back on talking about perimenopause and menopause because, you know, our hormones change as we get older. Us women, we have them, but they're in different ratios, doing different things, and we need to tackle that part of life as well. So, before we go, where can people find you?
I have a website, the Wellness by Design Project.com, and I have a YouTube channel there too. I'll be happy to share this program over there.
Wonderful. And thank you so much. And thank you, everyone else, for coming in today. on the website, sarabantahealth.com, I've got an article, lots of things talking about estrogen dominance, also talking about how to get all that protein in. There's keys to do it, and you will feel so much better. So thank you for listening. Join us next week with Katie Wells. We will be talking about the stresses of life as a mom and how to handle it. And as we know, that stress can cause issues with our hormones. So let's learn how to manage those stressors. So our discussion does not have to stop here. If you're feeling lost in the supplement world, don't worry. I'm here to help, to tell you how to support your hormones like progesterone with the supplements, or just your weight loss goals, your insulin resistance goals, whatever it is for you. So you can get my free supplement protocol. Just head to sarabantahealth.com, complete the form, and I will personally put together a protocol for you. Follow me on social media at Accelerated Health Products and join the free group coaching on Telegram. I answer all of your questions. I post on a daily basis. You hear from others. You hear their reviews, their testimonials, their questions, and it's a way to keep moving forward on a daily basis. You can find this podcast and all my podcasts at Accelerated Health with Sara Banta on Spotify, Apple, iHeartRadio, and over 100 platforms. And use the coupon podcast10 to get 10% off your first order of cutting-edge supplements at Accelerated Health Products. Thanks for joining us here, and I hope you have a great week.